Great. Hello, good afternoon. Thank you all for being here today. One of the things I wanted to talk about when we were talking about the LSU AgCenter's Healthy Communities is sometimes when I go out in the field or talk to other groups, they don't really know what the LSU AgCenter is. And so the LSU AgCenter, though, is the outreach arm of the whole LSU system. And so what we do is we take research and evidence and we bring it to the communities in ways that they can use and that are meaningful to them. And what we have a great framework for dissemination of evidence-based practices. We have professionals in every parish of the state, so 64. And we also have research stations that may be like a sweet potato research station, your sugarcane. And all of our field associates, though, work directly with the community. And we find that we have a real strong following or a strong trust in our more rural communities that may not have access to a lot of the things that our speakers here talked about. So what is Healthy Communities at the AgCenter? It's an initiative that helps make Louisiana towns healthier places to live, work, and play. And these are facilitated by our FCS agents who work in the community to make healthy food more accessible and affordable, ensure that outdoor physical activity is safe, accessible, and fun for all through what we call PSEs, which are policy, systems, and environmental changes. And I'll talk a little bit more about that. But again, you see our ability to help a community much greater in rural areas where they don't have some of the expertise that we may see in a Baton Rouge area, a New Orleans area, a Covington area, things like that. And so in most cases, when someone needs to change a behavior or they're trying to make healthier choices, it really needs to be supported by those systems and environments that are going to be helpful for this person in achieving that behavior change. And so when a person tries a behavior or tries to change their behavior and it's not supportive, they're more likely going to stay where they're at that point. And so education alone is not going to do the trick. Education combined with policy systems and environmental change is arguably more effective, economical, and sustainable than using either strategy alone. And so within Cooperative Extension, or within the LSU AgCenter, we're part of the Cooperative Extension Network, and so is the Southern University AgCenter. And we have to follow a framework, and it's called the Framework for Health Equity and Well-Being. And so you could see the social determinants of health outside the core. Within the core is health equity. So everything we do needs to be equitable. We're not just targeting those populations that can come to our meetings or that like us or that call our office a lot. We need to target the entire population with equity in mind throughout the entire way. And so what cooperative extension agents do is they pull in those partners who have the expertise to help this community identify changes they can make to their community so that it fosters healthy preventative behaviors. And at the same time, we know that we can't do this alone, so community coalitions and partnerships are critical, but that's where extension can come in and bring the people who need to be there at the table. So how do we take this framework and make it work? Well, here's our approach. This is called our Healthy Communities model. Our agents in their parish will get to know their community through a variety of assessments that I'll show you in just a second. They'll host community forums, and not just at one central place. They'll go all over to make sure that they have a representative sample of those who live in that community. We then form community coalitions that are from different sectors of influence within the community. And then from there, that coalition, we kind of say, drives the bus. And they use pooled resources to make those policy systems and environmental changes according to the needs identified by the community. We are not prescriptive in this approach. We know that every community is very uniquely different. And if we were going to be prescriptive and the community couldn't get behind some of these interventions, it wouldn't sustain itself. It would die as soon as we took our hands off of it or as soon as the grant funds ran out. We then continue to support the changes that we've made within the systems or within the food environment with education, so the nutrition education that Dr. Queen just talked about, and technical assistance. And I'll describe more about what technical assistance means in a minute. So our needs assessment, everything is community participatory. We do community forums where the community is able to tell us what their barriers, assets, and challenges are, and we really hone in on those assets so that we could build off of that, because no matter how poor a parish is, they have assets that can be leveraged. Are any of you from upper rural areas up north, like Madison, East Carroll, West Carroll, Morehouse, Tensas? No. Okay, go visit there if you ever want to go there and see how challenging it might be to live a healthy lifestyle. In some of those parishes, they have water issues where we have to have boil advisories constantly. And so it's those type of things that we're trying to navigate within the community. So if we find that we didn't get a lot of people out to the forum, then we're gonna go out to them and do like a drive-by community forum so that we make sure we have the voice of those who are most impacted by chronic diseases, food insecurity, things like that. And we got a lot of people to come into this drive-through by offering free king cake, everything in moderation. But there they are. We do a variety of assessments, whether it be asset mapping, walk audits before we're going to do an intervention. Is it safe to do a bike to school day? You see this red arrow here. This is showing to community members what happens when a sidewalk ends and someone is trying to navigate that with a stroller. They may have mobility issues, a walker. And so this helps those decision makers in that community prioritize what interventions they're going to do. We then, we take the community with us, because everything is community driven, so that they can actually see what some of the challenges are. And then we take all that data and put it into either asset maps, food systems assessment, and do things such as data walks, presentations, so they can understand all the dynamics of their communities before they make decisions. The other way we get people in there for some of our assessments is to do big events that have children involved, and this was a great partnership with CPEX. Are they still in the room? I'm going to talk about them later because they've helped us really do a lot of this built environment work and complete streets, and so I do want to acknowledge them. But the point of this being is everything, our assessments, we do a lot of formative assessments, and these aren't even our published manuscripts here, but we do focus groups on barriers and facilitators to food access in rural areas. We did a surveillance of all SNAP authorized dealers to look at the affordability, the accessibility of healthy foods. We also looked at the marketing environments in our SNAP authorized stores, and those are all published. I'm going to show you the link to where you can get them. But in addition to that, we do community participatory assessments too. And so from there, after all the assessments are done and we can provide this information back to the community, we then form coalitions. And whoever wants to be on the coalition can. There are some people that are invited because we know that they may be the decision makers and we need them to make changes. We also have youth coalitions. Youth in rural areas are very powerful. Their voice is very powerful. They may be the future decision makers, taxpayers, and residents. And they also have really great ideas in terms of what they want to see in their community that could help them be more physically active and eat better. And so we call it HYPE. It's Healthy Young People Empowerment. And they also take part in a lot of the interventions, but as well as the assessments that we do in their community. Typically, our communities look different. Again, we're not prescriptive. We take all the evidence and then provide them, or take all the assessments and provide them with some examples of evidence or practice-based interventions that they could use to improve food access in their community. And typically, this is the ones that we implement. I'm not going to read all this because I'm about to show you what they look like. School and community gardens, of course, we know the benefits of gardening. We know the benefits of community gardening, although it's a very labor-intensive, so you have to have the right partner to do that. But in most of our communities, we do have several of these. We then work to either establish or support rural farmers markets. How many of you have been to the farmers market in Baton Rouge? Okay, rural farmers markets are completely different. And they can be very sustainable, but they provide a great economic benefit to their parish and another access point for healthy foods. And so you see this pretty picture right now, and it sums up everything that we've accomplished with this farmers market in St. Helena Parish. But I kid you not, this started in 2014. And this started in 2014 with farmers backing their trucks up in one central spot, one central location to sell foods to the residents of their community. Over time, we secured a more prime spot location. We then educated them on the importance of accepting SNAP benefits for their community. That's where our technical assistance comes in. We break a really cumbersome process down to simple steps that they can take to register. After we got our bearings straight a little bit, we then worked to get a SNAP match program from Gus Snip, which was awarded. And you could see before the SNAP match, we would reach people in about 3 parishes. And after the SNAP match, you could see how more and more people were coming to this market to stretch their food dollars. We've made it more of a continuing operation in St. Helena. We spotlight all the vendors, so there's Mr. Hall, and we actually did cooking in the kitchen with our farmers so that they could cook their favorite recipes from the food that they produce there. And so a lot of these interventions, especially in rural areas, don't happen overnight. They happen working with the people, getting input, and kind of letting them see the benefits of this for this community. But when you do this type of work to change a system, to change an environment, or even to get a policy established, it takes years. And I decided to do this type while I'm on a tenure track at LSU. So let's just note that and pray for me. But one of the other things we do in rural areas is we build capacities for food pantries. Many food pantries in rural areas are out of a church, out of a council on aging, out of a community center. And so what we found with the pandemic is that the federal government was ready to send food, cold and dry storage to these food pantries, but they didn't have any way to store them safely. And so one of the grant fundings we were able to go in there very quickly, build the capacity up for these particular rural food pantries to accept cold foods and dry storage. And so we bought them refrigeration units. There was a kicker. They have to work with us on the nutrition guidelines and policies so that when they do get donations in, there are more healthful foods that their patrons can get. And so you see our little nutrition policies there. The other thing that we've launched in addition to rural food pantries is school pantries. So in St. Helena, we're launching 3 school food pantries. They only have 3 schools there in collaboration with our East Baton Rouge Food Bank here. And so that is launching in November. And right now we've done the formative, but we have to do the process and outcome evaluation on that. So speaking of building capacity for food pantries, we've heard from a lot of residents through our qualitative evaluation that they wanted fresh fruits and veggies. They were particularly tired of getting black beans in the northern region of the state. And so we thought that we would launch what's called Grow Row. And these are where home gardeners or farmers can dedicate a plant or a row, and they go and collect that and give it to the local food pantry on certain days. We piloted this in the Northeast region, and it's going to go statewide in January once we worked out some of the kink. But this is one of the ways that we can get fresh produce to our Council on Aging partners, our food pantry users. We also do healthy retail interventions, and we're doing one that was not based in Louisiana, and we found from our partners that they like Louisiana-themed healthy food retail interventions, so we now have a new program called Go Shop Healthy. And this is a program that works with the community to survey them to see what foods they would buy at that particular store, and if the store doesn't have it, we work with the store owner to get it there so that A, the store owner doesn't lose money, and B, the patrons are getting the types of food that they would want to buy and cook for their children that are healthier. In the back corner, we're in between the snack bar out there, the granola bars, I gave you a little sample of some of the Go Shop Healthy things that we do, because our agents will go in there and do taste tests and food demonstrations, and we also give them recipe cards that are targeted towards SNAP eligible clients. So they're very low cost, and they're usually 2 meals in one. So you get 2 meals out of 1 chicken. And so we have things like that to help the patrons be more successful in healthful eating wherever they can shop. Physical activity interventions. So I'm talking quick because I could talk all day about this and the different type of interventions we have going on within the different parishes of the state. But physical activity interventions are also the one that we target in rural areas. It is very, very challenging to be physically active, walk to everyday destinations for lack of crosswalks, lack of shoulders. We are working with the parish that has no playground whatsoever in the entire parish. And so when we were working with that youth coalition, we had to drive them over to a parish an hour and a half away to show them what they could have in a playground. And we're working with Dr. Mary Beth Lima from LSU on that. But that goes to show you that it's not as easy when a pediatrician or a healthcare provider may say your child needs to get more physical activity throughout the day. As a parent who may be working, who may not be at home, and there's no safe places to really go, what do? And so what we've tried to do is make the environment more conducive to everyday walking and everyday physical activity. So here are just an example of the different things that we do. Again, I'm going to do a shout out to CPEX because they have been helpful and they showed us the art of a demonstration project. So when you go into rural communities, there's usually no like striping or, and in order to convince people that things can work, you have to show them how to do it. So if you see this walking in the blue right there, this was a demonstration project again in St. Helena. St. Helena was kind of our guinea pig for a lot of this. And there was no parking by the courthouse. And so people would go and just kind of park on the grass to go pay their bills. But it was a real problem for people who used walkers, wheelchairs, who were pushing strollers, because they would have to walk behind the parked cars who could back out and hit them. And so we said, what if we pushed the cars back a little bit? We used our chalk and our paint and then created a crosswalk. Do you see how much easier it is for someone to feasibly walk up to the courthouse to pay their bill rather than almost getting run over? And so through some of these demonstration projects, the community works with us to identify some of the more dangerous cross sections, the more dangerous place to be physically active. And that's where we might put environmental supports like pedestrian crosswalk signage by calling DOTD and putting an order in, and things like that. Some of the other, we do indoor playgrounds for children on rain days, so they still have the opportunity to be physically active. If we have a school or a site that has no equipment whatsoever and it just looks bare and run down, then we'll go in there and paint stencils for them with a community of volunteers. We also do something called rural play streets, which before the COVID pandemic, our plan was to have these at summer feeding sites where more of our children were going in rural areas, and this would be another opportunity for them to be physically active. But we know what happened to summer feeding sites. It was more of a grab and go once COVID hit, and so we've kind of changed up how we do rural play streets, which we're actually involved in a study with Baylor right now on this, on the outcomes related to it. Environmental prompts, as we call them, or walking trail signs, have been a real need in a lot of communities. They may have a pathway or some type of trail, but there's not like some of the prompts that you need for wayfinding or placemaking, things like that. So we started off with adult walking trail signs, and those were a really good hit. I want to say they've been installed in 15 different parishes. But then some of our teacher friends and our agents who used to be teachers or have a great creative imagination created some that are for youth as well. And so if they don't have a lot of equipment in their ECE providers, then we have different prompts throughout the way, like stretch like a monkey, jump like a kangaroo, different things like that. Another intervention we do is story walks. We have great partnerships with rural libraries. Why rural libraries, you might ask? Is because that's where most people go to get their Wi-Fi connection. And so it's a great point to capture the parents and the children all at once. They increase their food literacy for most part with the book, and they're physically active at the same time. We evaluate it with QR codes and things like that. The other thing we've done, as we watched people be more physically active in our rural areas, we were like, whoa, they don't know the correct pedestrian or the rules of the road. And so we have a massive, there's actually some even here in Baton Rouge, social marketing campaign that focuses on pedestrian safety, such as if you walk, face traffic, you bike with traffic. And we worked with some of the biking experts to come up with rules of the road and the hand signals and things like that. So these are kind of some of our physical activity interventions we do. And of course, as Dr. Queen mentioned before, we do all sorts of education, cooking camps to increase skill sets among youth, or we'll do family cooking camps to increase skill sets among both. We also do education. We now do virtual education for those who may not be comfortable sitting in a group setting or just want to learn at home. But we offer them at different venues. We even do yoga in rural libraries. So it's very calming for the kids, gives them something to do, because we have found that there's an opportunity for a lot of different outreach in the summer, because there's not a lot of summer camps going on. And so that's where you see the AgCenter will put on a lot of their cooking camps, chefs in the kitchen, things like that. Research and evaluation. So our paradigm kind of is a transformative evaluation paradigm, which is mixed methods, but it promotes, it's used to promote social justice and really uses the voice of the people to figure out what interventions we need. So we're going to go by the evidence, but we're going to listen to what the people say in a particular parish, because if we want this sustainable, they have to believe in it, they have to think they need it, and they have to buy into it, for lack of a better term. So we do a lot of qualitative evaluation, which is, this site right here, you can find all of our peer-reviewed journal articles, as well as some of our reports that have gone to CDC. But we are doing a long-term evaluation to see what happens when you have a lot of education, technical assistance, policy systems, and environmental approaches. How long does it take to trickle down to the people? And what is happening with their behaviors? Are they changing? Are they staying the same? And so at the leadership of my research associate, Catherine Seals, we did a long-term evaluation in 3 parishes and had an 84% response rate, because we went door to door and we used community workers. And by doing that, they also learned more about their communities and more about some of the struggles that participants in their communities work with. And so we have just launched the follow-up of this long-term evaluation, and we're actually data collecting right now. The baseline data is going to come out in a journal article in November for health promotion practice, because we also talk about how do you get a representative sample in rural areas. If you look at breakfast, some of that, for some of the parishes we work in, it's based on who answers the phone at that time. So I believe Tensas had 4 responses. Well, we have over 200 responses in Tensas, because we're trying to get a more representative sample of what's going on with the health, behaviors, and access of these communities. So again, all of our research can be found here. You see here, these are our community health workers that we train to go door to door. Some of them were retired census collectors, so they were perfect for this. But even the mayor, and if you look at this picture to the far left, the tallest male in there is Mayor Matt of St. Joe, and he even went around with us to some of the data collection because he wanted to learn more about his community. All right, so what are some of the outcomes we've seen so far? And just note that this is only until 2021. Our CDC 2022 just came in, and I didn't have time to put it in there. But we've established about 1,200 partnerships. We either facilitate or are engaged in 98 Healthy Communities coalitions. With the community, we have implemented 242 policy systems and or environmental changes that are designed to increase food access, increase healthy food access, and increase access to safe places for physical activity. About a little over $4 million in outside funding. These are not with the SNAP-Ed or CDC grant that I have, which is about $5 million in funding, and almost 4,500 volunteer hours. And I know our leverage funding for last year went up to $600,000 because one of the communities we worked with hands-on got a Rec Trails grant, and so we're really excited for them. Others examples of some of the food systems PSE changes we've worked with: 13 food outlets implemented healthy retail, 7 food pantries increased their capacity to procure healthier foods, 4 food pantries adopted policies. It takes them a little while. Policy is usually the last thing that comes about because it's the hardest to get to, but it's got the most teeth, and so you want to go for policies. 2 new farmers markets were established, and 4 existing ones were enhanced by now implementing SNAP acceptance or double up bucks. 24 new connections made between local producers and local food retail opportunities. Now here's the interesting part. So we actually measure linear miles and how we improve the physical activity environment, especially with our CDC high obesity. So we did create 8 linear miles and 10 destinations. You people are probably saying, that's not a lot at all. It's a lot. And it takes a lot of work to get that in rural areas. And it's been improved through the installation of wayfinding signs, speed bumps, crosswalks, and sidewalks. And so we've had a really good relationship with DOTD now, which I never expected as a registered dietitian to be doing. 3 connectivity plans with the help of CPEX here. And these connectivity plans have really helped these particular parishes to go after the big funding, the big federal funding for like recreational trails. And actually next week here in Pennington, we're working with DOTD and 12 different communities for funding based on President Biden's infrastructure bill. So we provide that technical assistance because they don't have grant writers sitting in their office to be able to do this, but that's where we provide the technical assistance to them to be successful to go after these funds. We actually also have a joint use policy passed in St. Helena that now allows community members to use an existing school track for physical activity outside of school hours. And our agent worked relentlessly with that particular school board, but that school board has been one of our greatest and strongest allies since we've started this type of work. I talked fast because I had to get done in 30 minutes, but if you have any questions, please feel free to contact me or our Healthy Communities email. And we also have a web page as well. Again, on the snack bar in the back where they have the little granola bars, we have information about Healthy Communities as well as some of the recipes and things that we use to support our healthy retail interventions. Thank you.